All right, welcome everybody. I'm excited for today's call because I have new information in terms of COVID to share with you regarding helping you understand the disease process and giving you hope in terms of if you were to get infected, what to do at certain steps of the infection. So as always, the disclaimer first, this call doesn't replace your conversation with your primary care provider, so don't implement anything from this call without first speaking to your primary care provider. If you are seeing this recording, then I can't guarantee that the material that I'm sharing on the recording is up to date at the time you're watching it. So always look to get the most up-to-date information. And I can't guarantee the completeness or accuracy of what's shared on the call, just what I have gleaned from the research up to this moment. So with that, let's dive into the latest COVID information. And the first thing I want to share is the Captain Obvious article of the day, which was put out by Medical Express and other news. Now mainstream news channels are picking up on it. And it's the Captain Obvious article of the day because I've been talking about this since the whole COVID fiasco began. And my natural strategies for coronavirus video was actually censored and pulled down off of YouTube because apparently they don't want the promotion of any material that could help you that isn't pro-vaccine per the WHO's recommendations. But the evidence is here. The latest research says, drum roll please, after studying global data from novel coronavirus pandemic, researchers have discovered a strong correlation between severe vitamin D deficiency and mortality rates. Duh, we've been talking about that. The countries with the highest death rates, such as Italy, Spain, and UK, had lower levels of vitamin D compared to patients in countries that were not as severely affected. So again, this isn't really groundbreaking news to those in the healthcare community that have in-depth understanding of immunology and nutrition, but vitamin D is big time important for immune function. And the reason it's specifically important for infection is because vitamin D activates the innate immune system, your macrophages, which are the first responders to infection. You're going to have neutrophils first, followed by macrophages. And basically what the neutrophils and macrophages do is they go find the infected cells. Okay, so if you have a COVID infection or a SARS-CoV-2 virus, that virus is an intracellular infection. So what it does is it infects your cells, it hijacks them. Intracellular meaning inside them. So your immune system has to go find infected cells and phagocytose them or eat them up. And that's how we get rid of the infection, by getting rid of infected cells. Well, vitamin D plays a big role in that because when the cells perform phagocytosis or they eat your infected cells, once the macrophage has engulfed that cell, it releases what's called lysosomal enzymes, which then go and degrade and break up the cell and kill the virus. So if you're deficient in vitamin D, your production of lysosomal enzymes by your innate immune cells will be subpar and you may not clear the virus the way you need to. On the other end of the spectrum, as you'll learn today, vitamin D is a massively important anti-inflammatory. So if you don't kill the virus in the early stage, in the infection stage, and you end up in the escalating inflammation stage, you'll learn all this in a little bit. Now you're massively inflamed, and those are the cases that become more severe and may go on a respirator. Well, if you have poor vitamin D, you could picture it as having an empty fire extinguisher. So unless that fire's small enough for you to stomp out with your foot, that fire's going to grow, right? And now the case becomes more severe, and maybe you develop lung issues, need to go on a respirator, and it's bad news from there. The research out of New York City says 88% of patients that go on a respirator end up passing away. So the goal is to not be on a respirator. So that's the Captain Obvious post of the day. And what I really want to talk about, and I'm really excited about today, is a study that came out this week, published by a mentor of mine named Sam Yannick. And it's called Evidence Supporting a Phased Immunophysiological Approach to COVID-19 from Prevention Through Recovery. And this article is awesome because it lays out the infection in phases, and depending on what phase you are in as a patient, changes what the correct treatment is. And so depending on what phase you're in also depends on how aggressive you need to get with treatment. So we're going to get to that, but I want to first help you understand some definitions. So first, to understand inflammation, I think they did a great job defining inflammation in this paper, and I'll just read it to you. Inflammation is not a single process that simply goes up and down, but an orchestration of interconnected processes with a choreography that normally includes the chemistry of activation as well as resolution, with many factors involved in regulatory processes that determine the total outcome. So that's a mouthful, but basically what we think about as lay people, when we think of inflammation, we think of swelling and pain, right? Because we've all sprained our ankle, it's become inflamed, it's been painful, it may have been bruised, it's swelled up, and you lose range of motion or lose function. So that's inflammation with acute injury. But your ankle doesn't stay painful and stay inflamed, right? Eventually it heals. And the healing part is the resolution phase, or you're resolving the inflammation. So in order to go from activation, you have that injury, all the way through resolution is an orchestration of choreography between immune cells and other processes. So if you have a SARS-CoV-2 infection, SARS-CoV-2 is the virus that causes the disease COVID-19, just like HIV is the virus said to cause AIDS, right? So if you have a SARS-CoV-2 infection, it would be appropriate to have immune activation, right? We want inflammation because that's the immune system's first response to infection, to go kill it and prevent it from getting worse and advancing to COVID and respirator severity, right? So we don't want to be on anti-inflammatories during an acute infection because we may be working against our immune system's ability to do the right thing, which is clear the infection. But just like you don't want to inhibit inflammation when you're infected, you don't want to stay inflamed once the infection is cleared, right? You want resolution. So if you clear the infection and you don't resolve the inflammation, now you're promoting chronic inflammation, tissue damage, and risk of autoimmune disease and things like that. So we also want to be able to quiet the inflammation once we know we've cleared the virus. So all of that takes orchestration and choreography to occur. Now, they also did a great job of defining what I would say, we could use this definition for functional medicine, or just how every patient should actually be viewed and addressed in the healthcare model. So I'll read that to you as well. And this is very relevant for the COVID infected cases too, because as we're going to learn, there's multiple phases a patient could fall in. So if we just have a hospital floor full of COVID patients and they all get the same treatment, we're going to fail a bunch of them because they're not all in the same phase of the infection or the sickness or the disease. So for every patient, there's a moving multifactorial equation that determines the status of their interconnected systems, such as the inflammatory process specifically, which is itself is multifactorial, like we just talked about, the choreography, the effectiveness of resolution chemistry and other modulating mechanisms, and their overall host defense response generally. So let's say that again without me interrupting, okay? For every patient, there's a multifactorial equation that determines the status of their interconnected systems. The equation consists of inflammatory process, effectiveness of their ability to resolve inflammation, and other modulating mechanisms, and their overall host defense response generally. So how healthy is their immune system generally? All of that falls against the backdrop of any comorbidities or pre-existing conditions already present. This set of variables needs to be addressed with discernment when crafting approaches in the clinical setting. So what that's saying is everyone's an individual, right? And We can't just say, oh, they have COVID, do this, or oh, they have MS, do this, or oh, they have insulin resistance, do this. That's the cookie cutter McMedicine, drive through the fast food chain healthcare. We don't want to do that. That's not going to help people. We need to understand what comorbidities are present that they had before COVID infected them. What phase of COVID infection are they in? And that helps us understand how to address that individual. To better understand that, they do a great job with this graph. So what this graph shows is time on the x-axis and the individual person's level of inflammation on the y-axis, okay? So, and then this upper dotted line here is the patient's fatality risk threshold. So meaning if their line goes above that, they're gonna die, right? So let's say we have two patients, A and B, and each are infected with SARS-CoV-2, resulting in COVID, right? So if person A is the green line, when they're infected, they have a low inflammatory status at baseline, their systemic inflammatory levels are low, then the crescendo of their COVID infection is only going to get them about halfway up to what would be the fatality risk threshold. So this person was infected with low levels of inflammation, likely had no pre-existing conditions. They may, if they're symptomatic at all, that it's probably going to be one of those cases that's the mild flu, right? They say up to 80% of people will be asymptomatic. Then some will have a mild flu and severe cases will be worse. Okay, so this person, because they didn't have pre-existing conditions, because they had low baseline inflammation in their body, they were able to either not even realize they had the infection and beat it, or they had a mild flu and got over it, okay? Person B has pre-existing conditions, okay? What are the pre-existing conditions with the highest risk factors for severe COVID? The main non-pulmonary risk factors are hypertension, so high blood pressure, diabetes, cardiovascular disease, and cancer. Pulmonary risk factors include asthma, COPD, and other respiratory diseases. So person B has one or more of those, okay? Let's say they have asthma and high blood pressure, okay? So they've got two pre-existing conditions. Their baseline inflammation is already halfway up the table here. And if they get the COVID, the SARS-CoV-2 infection resulting in COVID, then their case has a much higher probability of going severe, maybe needing a respirator and perhaps perishing or passing away, because they started with comorbidities. They started with a high baseline of inflammation. Now the infection is going to drive those inflammatory levels even higher. And if they can beat it, it's going to be a rough road, okay? If they live through it, it was a rough road compared to the same person who was healthier. So again, we need to take each person into account and their individuality and uniqueness. So let's look at the phases of the COVID infection. So these authors do a great job of laying out what the phases of infection look like. So across the y-axis here, we could call it, or the vertical axis, are 5 targets of support, and across the x are the 4 phases of the infection. So prevention is phase 1, right? You're not infected. What can we do to prevent COVID infection? One of those things, as the study, the Captain Obvious study was showing, is optimal vitamin D levels. The study found that the more deficient you are in vitamin D, the worse the outcomes of the COVID infection. So vitamin D is one of the things we want, but then there's other things like zinc and vitamin C and selenium and many other things. So prevention phase. Then there's infection phase. Infection is you're infected, right? So if you're infected, now we have immune activation. During this time, we don't necessarily want to be on anti-inflammatory support, right? Because we don't want to suppress our immune system's ability to respond to that infection. So during that time, we want to support natural killer cells and support the Th1 immune response, because those are the primary antiviral responders. We want to be able to realize we're infected and go in there and eat, okay, and eat fast and clear it. But in some cases, we don't do that, right? The research and anecdotal reports out of hospitals and clinical reports are showing that some people could be infected for 6 to 14 days before they show symptoms. So if someone is infected for 2 weeks and that virus is replicating before they show symptoms, they may progress quickly. So if they're one of the people who progress quickly and maybe have comorbidities that start them on the B level, right, then they may have escalating inflammation. They may get bad quick. Okay, so that's the time when they need to be in a conventional medical doctor's office, maybe a hospital, but at the same time, they need to be supported with anti-inflammatories, whether that's natural or pharmaceutical, or natural in addition to pharmaceutical, I should say, because at this stage, they need to be in the medical model. Okay, so escalated inflammatory stage, that's going to be a more severe case. Now anti-inflammatories matter because now the virus has established hold and is creating so much damage, so much inflammation that those fires need to be put out. If we do that successfully, then you're in recovery. And in recovery, we want to continue promoting optimal anti-inflammatory status and optimal, I'm sorry, I'm showing you the wrong page, optimal antioxidant status. So you can see here that there's foundations we want all along, things like multivitamins, vitamin D, vitamin C, those sorts of things. We want antioxidant support all along because the infection is known to drive high levels of oxidative stress or rust, so we want the anti-rust. If we get infected early on, we want to support natural killer cells and Th1, but not be putting out fires. But if the case escalates to severe inflammation, we want to put those fires out. And then as we recover, you notice we want to continue with putting fires out and continue with the antioxidant response or support. Why? Well, because the research shows that there can be lingering inflammatory and fibrotic effects that occur in the tail of the curve after the crescendo of the disease has passed. What does that mean? If we go back to this picture, obviously the worst for both patients is where the crescendo is. So once we get over the crescendo, say this person lived and obviously this person lived. All right, so say we're down here, we're in the recovery phase and you may even be asymptomatic. But when this is going on, especially in the pre-existing condition patient, the escalating inflammation drives inflammatory damage to the body, drives fibrosis in the lung, drives scar tissue creation. So just because you're asymptomatic doesn't mean that those processes aren't continuing, or doesn't mean that we can stop pushing back against those processes, right? So where that comment in the paper was saying we want to continue to push against lingering inflammation and lingering fibrosis, because that can still be going on even though we've recovered, even though we're asymptomatic. We could be recovered and asymptomatic, but not optimal, right? So we need to still support pushback against tissue damage and optimal healing. So this is hopefully as enlightening for you as it is for me in terms of increasing your understanding and knowledge of the disease and how it can progress, increasing your understanding and knowledge of the fact that the healthier you are, the better you would do if you got infected, and understanding increasing your understanding and knowledge that there are natural things you can do. Okay, what are those? Well, pre-existing conditions, right? Hypertension, diabetes, cardiovascular disease, cancer, asthma, COPD, respiratory infection, respiratory diseases. Everything matters. I made another video about 2 months ago called Principles Over Pandemic. While the whole world was saying there's nothing natural you can do, we have to fast track a vaccine or we're all going to die, I made a video and said, no, principles over pandemic. Health is health. The principles of health are the same regardless of what the latest thing we're scared of is. Okay. So we just saw that the more unhealthy you are, the higher your risk of severe outcomes. Well, what can we do? Start today by promoting health. You're all doing that. Okay. You want to promote health. You want to promote optimal blood sugar regulation. You want to promote to keep blood sugar down. You want to promote optimal stress levels to keep hypertension down. You want to promote optimal sleep, optimal movement, right? All the things that we all give lip service to, all the things we roll our eyes at, but those are the keys to making us a green line instead of a red line. You want to be a green line. You can't just take a pill, whether it's natural or pharmaceutical, and be a green line. The green line requires daily consistent action, and that's what you're doing. That's what the people that are working with me are doing. You're creating a green line instead of a red line. Now, even if you're a green line, or if you're in the process of going from red to green, there's other things you can do. So the lifestyle factors all matter, but then again, when we're talking about supporting natural killer cells and Th1 immune response to kill viruses, what does that mean? Well, that's things like astragalus, things like berberine, things like vitamin C, okay, things like vitamin D and vitamin A. Those things all support optimal antiviral response, natural killer cell function. So those are natural things we can do. No matter how many times YouTube pulls my video down, that doesn't change the research and the fact that those things matter. If you get into the escalating inflammatory stage, now we want powerhouse anti-inflammatories. So there's pharmaceutical versions of that, which you'll get if you're in the hospital. From a natural perspective, that's things like curcumin, resveratrol, fish oils, et cetera, et cetera. Antioxidant support to prevent the rust and the fibrosis. The two heavy hitters there are glutathione and N-acetylcysteine. Those are the two heavy hitters, glutathione and N-acetylcysteine for antioxidant support. But then there's the berry-based antioxidants. And then we won't get into all that for you, but those are things you can do from a natural perspective to support yourself, and hopefully never get to where you would need to go to the conventional model due to escalating inflammation. But I want you to understand that the medical model has a role, and their role is acute care. So if you were to get infected and it progressed to escalating inflammation, which is the acute severe stage, you're not gonna get rid of that with curcumin or vitamin D or vitamin C. You have to go the mainstream medical route and get their help, and that's okay because that's what they're for. So I hope this helps you be more confident to go out and not fear being outside, fear going to businesses, fear living your life. Just be empowered, implement the things that the research is showing us are helpful and beneficial, and then live your life. So let's open it up now for questions. And let me unmute. Or Jennifer, you may have unmuted. Go ahead.
I think I did, yeah.
Okay.
So that's really interesting about the inflammation, like the fact that you should be taking anti-inflammatory stuff and then not.
Yeah.
So that your body can do what it's supposed to do, and then you could get to a point where you need it again. That's really, if it overtakes you, right? Is that what you're saying? Okay.
Yeah. So I think what I hear you saying is it's almost counterintuitive, because we hear anti-inflammatory, inflammation's bad. So there's never a wrong time for anti-inflammatories, right?
But there is.
But there is, right?
Yes.
Yep. So if you're trying to create an immune response and you can't because you're sucking down so much fish oil, then that's working against you.
Okay.
Right?
Yep.
So good aha moment. From a foundation perspective, that doesn't mean never take fish oil, right? Fish oils, omega-3 fats are essential fatty acids, and the word essential there means essential, meaning we can't make it, so we have to take it in either through diet or supplementation. So a foundational level of omega-3s would be about 3 grams a day. But if you get to escalating inflammation, that 3 grams a day is not going to be enough, right?
Mm-hmm.
And if you have an infection, we could argue that you want to pause that fish oil in the early going, because we want to allow for a robust immune response. And the fish oils promote resolution, when if we're infected, we want to promote activation. Make sense?
It does. So that's really with any infection, right? Not just COVID.
Oh yeah, yeah.
Right.
Any,
Yeah.
yep.
Sinus
Any
infection, really
Yep.
bad. Stop
Yep.
taking fish oil,
Yes.
right? So you
Yeah.
resolve it. Okay.
Yeah. In the
Yeah,
early.
that makes sense.
Makes sense, Adam?
Yeah, it does. Definitely eye-opening there.
Very eye-opening.
Yeah.
I do have one question though.
Sure.
So I know personally for me, what you diagnosed me with is low vitamin D, and obviously I have tons of inflammation in my body. So it's kind of concerning when it's like, oh, well, low vitamin D, and high inflammation could be causing or having more issues with this COVID. So
Mhm.
I don't remember if that was on my plan or not. The vitamin D, at least.
Oh, absolutely. Yeah. So just like we don't want to necessarily take high amounts of anti-inflammatories during infection, and just like down here, the definition of inflammation is the orchestration and choreography, right? So with your specific case, it's like you're an onion, and there's certain layers we want to put back at the right time. So you're early on, we're not using the D there yet, because there's a higher priority. And what you're going to find, and if you go look at your plan, you'll see that in a couple weeks you fold in the vitamin D.
Gotcha.
So it's in there, but it's going to come at the right time for your choreography.
Gotcha. That makes sense.
Make sense?
I knew you had these layers.
Mm-hmm. Yeah.
So it's really cool, because I'm like, okay. So Scott is with me. He just didn't want to be on video.
Oh, okay. What's up, Scott?
Hi, doctor.
He's written down a question.
Okay.
So, low vitamin D, do the supplements work without sunlight, or is that the point? He's asking.
Yes. If it is what the point?
That you can take the supplements and you'll still get the benefits of them, even if it's like super gloomy for a week.
Yeah, absolutely. And you need the supplements, because unless you're at the equator and naked almost all day, you're not going to get enough from the sun.
Okay.
And depending on the season, it's even worse. So and the latitude, so the angle of incidence of the sun is going to be different in Ohio than it is in North Carolina.
Right.
So and specific to, say, multiple sclerosis, the research shows that there's higher prevalence of multiple sclerosis the more north you go. Okay.
Yes.
And poor vitamin D levels are associated with increased MS risk. So, that's the tie-in. So you need to be supplementing with the vitamin D,
Right.
especially the more north you live, regardless of whether it's summer or not.
Okay.
And then how much do you need depends on, or would be determined by, okay, for every patient, it's a different puzzle, right? So testing helps us understand, in Jennifer, what's your vitamin D, how should we dose you, and as it improves, how do we tweak your dosing, right? And then over time, we figure out a maintenance dose for you. Whereas for Scott, his baseline level may be higher than yours, so we don't have to dose as highly, and we get him there, and then his maintenance dose is different.
Gotcha.
Because here's another thing. A patient recently asked, well, why hasn't my vitamin D gone up? I've been taking it. Okay. Well, let's remember that the inflammation is a choreography and an orchestration, and it's never stopping, right? So vitamin D, some research shows that vitamin D, adults are on average probably metabolizing through 4,000 IU a day. Okay. So that's at baseline. So if you're never taking vitamin D, you're losing vitamin D every day, right?
Right. Right.
except for maybe, you know, if you spend a day out in the sun at the peak of summer somewhere really south. Okay. But for everyone else, we need to be taking vitamin D because we're metabolizing through it just at baseline, like normal physiologic metabolism, we're burning through it. Now add a comorbidity or add inflammation or add something else, and we need even more, right? So the person who's taking it and their numbers not going up, basically that's telling us, hey, we're breaking even or less with the dose we have you on right now. So we would need to go even higher, retest again later and say, okay, now it's moving. Now we're getting on top of that. Make sense?
That makes sense. Yeah, definitely.
Thank you.
He said thank you.